FM, Pauline.
Definitely. It's good to be back.
All right.
COVID held us back.
Oh boy, you can say that again. All right, so Hurricane Man, just lift that for me, please. Yes,
Yeah,
yes.
she's good.
Or she can do it.
She can do it.
That's an empowered woman there. Don't need you. All right, so Pauline is a registered nurse and also managing director at Health Solutions Inc. And this month of September is PCOS Awareness Month. And PCOS stands for Polycystic Ovarian Syndrome. By the mention of ovarian there, I think we can deduce correctly that is something that affects women. All right, so we're going to be talking about ovarian health, gynecological, that's a really big word, gynecological health as well. And in addition to that, we are going to be touching on how men are affected by it. Not that they get it too, but they will have girlfriends and wives and significant others, how they're affected and how they can then support to women. All right, so good morning, Pauline. Welcome.
Good morning,
Good
you
morning,
guys.
good
Good
morning,
morning,
good
St.
morning.
Vincent, and everyone listening in this morning.
All right. So we are also live on Facebook at Extreme 104 SVG, all right? So you can look at us right now, from anywhere you are, as well as listening via the radio via 88.5 or 104.3. All right. So we can start with PCOS, and I stated what it stands for, Polycystic Ovarian Syndrome. Maybe you can start with what is Polycystic Ovarian Syndrome. All right.
So, women were born generally with two ovaries.
Oh, generally.
Generally, yes. And we need the ovaries basically to ovulate every month and also to be able to bear children.
Right.
So, we need the ovulation because you need that egg to be released every month with your after your period, so that a mate joins in there and causes some fertilization. And, there you go. Boom, we're pregnant.
That's where men come in.
That's where men come in. It's a 50-50. You need both. One cannot be done without the other. So kudos to you guys on that one.
Okay.
But I think with Pcos, where things start to become an issue is, number one, Pcos is more a common hormonal issue. So what happens with Pcos is that a lot of the times by the time we pick it up on a patient, it's because they're either having some irregular periods, and you need your periods to be regular because that regular period pattern is what helps you ovulate as well, right? So, and then you also hear about women who are trying to get pregnant and can get pregnant and they can't figure out what's going on. Some may have somewhat of regular periods, or they are having periods maybe a little bit longer of a gap in between the two, and they still can't get pregnant. So with the hormonal issue, that's when stuff starts to happen. And it's quite traumatizing because you have these women that come into the clinic, these couples that want to come into the clinic, and they want to bear children, they want to have kids, and it's a whole dynamic that we look at. So you look at the woman herself, what are the symptoms that she's facing and how are we going to help her through this? You look at the partner, because the partner, it's overwhelming to the men as well, because women go through such a turmoil sometimes because it is a long process in some cases, and it's quite exhausting. It's draining on the relationship at times as well. So you got to give the men their support,
Right.
then also in hopes that everything that we're doing medically will give them the outcome of what the patient wants. A baby. And with some people, it's not even the baby. It's getting the regular period pattern, lighter periods, not feeling that unwell feeling that comes every month with, the hormonal issues and also with the heavy bleeding. So it's a combination of several factors we have to look at. It is something that's quite common. So, when women present themselves, one of the first things we do is, you're looking at assessment. So you're looking to see, why do you think you have a problem?
Right.
And then, a lot of the times the calls come in, WhatsApp calls, patients drop in, and they're like, listen, I haven't had my period for 3 months. I don't understand what's going on.
Wow.
And so my first question will be, well, are you pregnant? No, but I would like to be at some point. The period is just not coming. And then you also have the other cases where You look at a patient, you look at their facial features. Now with the mask, it's a little bit more harder to see, but the patient may show us to say the facial hair. So because there's that hormonal imbalance and there's too much of a particular hormone being produced by the women, you start to develop male-like features, right? So so
Whoa, I didn't know that.
So women start to grow hair on their face, hair on their chest, acne.
Whoa.
So all these things. as
I'm
you
just
see-
here just trying to think back
Yeah.
for myself. I'm like,
Yeah. And a lot of women are wondering, like, what is going on? Like, why is all this happening? So, of course, we sit down with them to explain that there is a hormonal issue and we have to start looking at that. And that's when all the testing begins.
wow. It sounds like a lot and it sounds really overwhelming, not only for the women, but you mentioned the men as well. They would come in, Gilly. Hurricane Man is watching me like, what?
She said,
Yes, she did mention that you also have to lend support to the men.
Oh, okay,
So
okay.
if a couple they're
You do.
trying to conceive
Indeed.
and that they're unable to, and the problem is that the woman is experiencing or she's suffering from PC. I didn't realize that this was
That's
not-
okay. I could hear you. I could hear you for hours. We're good.
All right.
There we go.
Right. And the female is suffering from, you mentioned Pcos. Some people say PCOS, all right? But she's suffering from that. I could imagine how the man would feel. I mean, he might be really wanting a child, and then you would go as far as blaming the woman, and then there are a lot of things involved.
Sometimes we leave because
Okay.
you've been trying hard, and
Yeah.
we leave. We
Yeah.
leave.
You guys are just going
I'm
and
taking the
going
blame.
and going,
Sometimes
and
we
nothing
leave.
is happening.
Nothing
We're toiling and toiling, and nothing is happening.
And
Yeah.
some men that do come into the clinic before the Pcos diagnosis is made, they're quite honest to say, "Is it me?" Right? So then we also assess the men as well at the same time that we're assessing the women. We do, yes, of course. You have to look at it as a dynamic, right? It's not just one person. You don't ever want to point fingers at anybody and make them feel in a way.
Yeah,
right?
yeah.
So, and I think where Pcos, it does some stuff to the female body that the woman also take a self-esteem knocking as well, because to grow facial hair, that's, you're just kind of wondering, where's all this stuff coming from?
Yeah.
And
I
then,
am only doing that because, like, okay, so to full disclosure, like,
yeah.
You have facial hair?
just a little something right here.
I just should just said that.
But I'm gonna say, like, what woman doesn't have?
well, that's it, right? So when you look at Pcos, it is in larger amounts a lot of the time. So
Okay, so this little
that 1,
3 grains,
2-3 grains
this is
there,
normal.
that's don't worry about that.
Woo!
But if you look at the acne, there's the features of the face tends to change quite a bit as well. You have quite a bit of acne that's quite prominent.
Okay.
And then weight gain. So on, and they're still putting on weight. So the body goes through all these changes, and when it does, that's when in return the relationship also starts to look at different things, and the woman's self-esteem start to take a knocking as well.
True.
And then certain men, I guess, prefer their woman in a certain way of a look, and if that changes as well, that may put a strain on the
Can I
relationship.
ask? I mean,
Yes.
like, particular look, like round or with hair, or I'm just asking.
It just weight gain, overall weight gain is what you're looking at. So a woman's size tends to
So they
increase.
get like thicker.
Yes,
Some men
and
look thicker,
sometimes
but,
not just thicker, it's much thicker, right? So everybody has their own preference, and that's fine. But you have to look at, it's not just what the woman is one thing, it's everything. And then people are like, well, treat me. It's not as easy as that. You have to look to see what is the issue and then correct the issue. So a lot of the times it's the symptoms that you're presenting with is what we're trying to. Now with Pcos, one of the things we look for diabetes as well. Because the
Diabetes.
insulin, yes. So what
Oh,
happens?
boy.
Type 2.
If you guys don't have your books out, get your books
I'm learning
out,
here.
all right?
I'm learning.
Pauline, you would have been mentioning a couple symptoms. I hope people are making
But what happens is the body is not processing it like it naturally does.
Okay.
And that's when the weight gain starts to kick in and all the other problems as well. So when women come in with Pcos or Pcos-like symptoms, and when we're assessing them, diabetes is definitely something we look at, and we look at their blood sugar levels and go from there.
Wow.
So
Okay.
it's quite a bit.
Wow. So quite a number of symptoms, right? So if we could just recap the symptoms.
Yeah.
You have the weight gain.
Yes.
You have the facial hair and like a lot of facial hair, chest hair. You also have, I'm trying to remember here.
You get rounder, thicker.
Well, that's weight
Weight
gain.
gain.
Weight gain. Okay, all
You
right.
see what he's saying?
yeah.
I think I realized what kind of
I'm
woman he
thinking
like.
We're not saying that the weight gain is going to be in one particular area of liking.
Okay,
It's weight gain, and we're going to...
The men are listening.
Yeah.
Yes,
Men or they're not.
yes.
Yes.
All right, so those are two. You also have the irregular periods,
yes.
the heavy periods,
or the lack of a period.
or the lack of a period.
Yeah.
So a couple months would pass.
Yeah, yeah.
And I know that some women think, okay, maybe they're in their late 20s and, oh, my period doesn't come for like 3 months. And they would say it's normal.
No.
But it's not normal because your cycle should be around
On
like
a monthly cycle, right? Some people run every 24 days, some 26, some 30. That's fine. But there is this pattern of a cycle that you look at. So everyone that comes into the clinic, we're asking, when was the last day of your last period? And then you ask about the pattern. What is your cycle like? Is it regular? Is it irregular periods? Do you spot in between your periods? So all those things with Pcos we have to look at. And then with Pcos is there's the investigative work that starts to go behind it. So it's actually quite simple. The process of testing is painless per se, because it's simple stuff. It's blood tests. You look
you
at
just get a
hormone
little
levels.
choke.
Yeah,
All
just
right.
a little, just this is a little. I call it the love bite.
Okay,
And
cool.
then you also have to look at, you do your pap smears to make sure nothing is going on in the cervix that might be causing problems. And then you do ultrasounds. Ultrasounds are wonderful because it gives you a really nice view of what the reproductive organs are doing.
Yeah,
you know?
they're wonderful when nothing comes up.
Very true.
Okay,
very
so
true.
Gilbert is a little bit confused. But when you do
I'm just
ultrasounds
listening.
of down there, right? Not
okay.
down there.
Not
down there. Pelvic
right,
area.
Right. Pelvic.
What
Yeah.
normally comes up in the ultrasound, like we get cysts, we get
Oh,
fibroids.
okay.
So sometimes you see these little growths, or sometimes they're big.
Yeah.
And some women are afraid to get ultrasounds because they don't want to find out
Yeah.
whether they have fibroids or cysts.
And you know what? We encourage it. Like a woman in their 40s, 50s, when they come into the clinic for, especially like annual physicals. I love annual physicals because that's our time to investigate. It be to give you a clean health bill or to tell you, hey, this is up. We've got to work on this so it doesn't get worse in the long run, right? And when you do pelvic ultrasounds, it's really good because you tend to look at the ovaries, you look at the uterus, you look at the fallopian tubes. But what I like about the ultrasounds is that we do transvaginal views.
What?
Yeah.
Okay.
Isn't that interesting word?
It is.
Transvaginal.
So hold on. What does that mean?
What is that? What is that?
So it's actually a probe that goes into the vagina. And it actually gives us wonderful, clearer images of your cervix and ovaries.
It has a camera in it. Like it's a camera.
It's the probe, right? So the probe, you get a little gel on it. The same way it's on the outside, the same thing happens on the inside. Obviously, the probe is covered, and infection control, all that stuff is taken to thing. But you take a look at it on the inside as well. So almost always in women who have been sexually active. Obviously, if you're not sexually active, I'm not going to introduce a probe in there. But if you're if you've been sexually active, then the probe goes in and it actually gives you better views. And with that, what we also look at is, other things. You look at for cancers, you look at for abnormalities. And it's not like, the tech hangs in there for a long time, just enough that proper images are taken so that a radiologist can actually tell you you're looking at healthy organs or something is brewing.
Oh, okay. So it's like a pap smear with a camera.
Yeah, but the pap smear takes a little scrub and a this
but
and
I mean,
that.
they
This
still
is
have
just
to,
a
like-
probe. Yes.
Gilbert, you know what happens during a pap smear?
Yeah. It's painful. Why is this painful?
It's
can be.
uncomfortable. It's
Yes,
uncomfortable.
yes, scraping and all that.
But
you know what I mean?
it, you
Well,
know,
I don't think the swab is the painful part.
No.
It's in inserting that initial.
yeah.
Sometimes, do they still use the metal?
Some people do. Like in the clinic, we use disposables.
Oh.
So I only have the metal stuff as a backup, but in the I like disposable because just you don't have to
Yeah.
worry about sterilization and it's one person use. It's nice and clean. It's sterile. You open
And
the
it's
pack, you
not
do it,
metal.
and yes, and it's not metal.
That metal cool thing.
And different sizes too. Like
Listen.
we have extra small to extra large, so
Listen.
everyone's body is different. Yes, yes.
You have bigger
And
probes and smaller
yes,
probes.
yes,
Okay.
yes,
Ah.
yes, for the ultrasound.
I'm learning.
For the pap smear.
This is a lot. This is a lot.
So, yeah.
So we mentioned, okay, so if you're just joining and you have any questions, we're talking about polycystic ovarian syndrome. It's a hormonal imbalance,
Mm-hmm.
all right, in the female body that affects the female's reproductive organ,
Mm-hmm.
right? I'm learning as I go along as well, even though I know a little bit.
And
all
right terms, very
Can I
Right.
ask a man a question?
Sure.
No, so you said
Does
that
it hurt?
there are times when a woman won't see a period for like 3 months. Could she get pregnant in that?
good. No, that's the problem. So with pregnancy, you need to ovulate. So after your period, a few days later or so, there's a process where the ovary releases the egg, it travels down, and it's a mature egg. Then you know what? That's great. If you're trying to get pregnant, that's the best time to really do your unprotected sex.
Oh, okay.
And
okay.
kind of aim to produce.
Yes,
and
yes,
and
rectify.
you go in and
Get that
then
thing in there.
that's time, right? So you need that process. And when a woman doesn't get pregnant, that's when the lining sheds and actually a period comes.
Right, so that's one of the telltale signs as well, not being able to get pregnant. So don't blame the woman, guys, okay? And ladies, don't blame
Yeah.
the men. It might just be Pcos.
Yes.
Okay.
And it's hormonal, right? So you have to look at it. What is it? Do the proper testing. Like I said, you do specific blood tests that caters to specific hormones. And you look at it and you see, is there elevation? Is there a lack of? What is it? And then you try and treat those issues in hopes that you cause some form of cycle start or normalcy in the cycle itself. We
okay.
want to bring you back to a normal, quote unquote, cycle pattern so that your period comes, you ovulate, and
Okay, is Pcos something that develops in time in the female? Like, what causes it to happen?
so see, we don't have a cause. Like, it's not like this is what causes
Like,
it.
you ate spinach.
Yeah.
That's why,
Hereditary.
that's why you got Pcos.
No,
Oh,
right?
no.
So
It's not because of spinach.
No,
Say that back.
not at all, not
know, it's
spinach,
a
not
random thing.
anything. But then we have to look at the whole picture, right? Is there a history of it in the family?
Okay.
You look at lifestyle. Has there been sexually transmitted diseases?
Ooh.
Like
Chlamydia, all of that stuff, right? Like, is there something there that's causing a problem? But hormone is primary, where we target. Diabetic woman is where we look at, and it develops at any age. We have young girls in the clinic who are maybe in their early 20s and they have irregular periods.
Okay.
So it could happen as early as when a period starts with a young woman or a young girl, and then it kind of goes up.
All right. So if you guys have questions, you can hit us up on the WhatsApp 430-1043, or you can send your questions via Facebook as well. All right. Someone says, good morning. Can you have a child years before and then not be able to get pregnant after that?
Well, it depends why you're not getting pregnant after that.
Oh,
Right? You have cases where women who have children or a child in their teens and then not have a child again until 30 something, right? You have to look and see, is it protection that you're actually taking that's not causing it, or there's an underlying medical issue? Now,
so it doesn't necessarily lead to Pcos.
No, no,
Okay,
not,
okay,
not,
okay.
not in that sense, but Pcos can, cause infertility and lack of
Okay.
allow us to be pregnant.
Okay. Across the board,
Across
regardless of the
Yeah,
age you're
yeah,
trying.
yeah.
Because I
Now-
think I got that as a similar question from
Yeah,
someone
so
else.
age plays a big role with women. You know how we make a joke about how women have a ticking
Ticking
time. It's ticking.
time.
Yeah,
Yes,
your
yes.
biological clock is
clock,
ticking.
and that's
ticking
very
away.
true
Yeah.
because
Ah.
the prime years, obviously, to have a child is in your 20s. Once you reach 33, 35, doesn't mean that you can't, but your percentage chances kind of decrease just
Reduces.
because you actually, the hormones change with age, right? So the body changes, and that's where. So if somebody who had a child in their teens or in their early 20s and now in their late 30s are wanting to get pregnant, then just go get checked out, make sure everything is in check,
Okay.
and then go for it.
All right. So there are a couple other things that we can touch on concerning Pcos. Pcos. Pcos, all right? Polycystic ovarian syndrome. We have a couple other responses to get to as well. But we're going to take a quick break and come right back within the 9 o'clock hour with some more information concerning your female anatomy, hormonal imbalance, and getting back to that sense of normalcy down there.
And again, and I mentioned to you, I think on the phone, Crystal, that we have Pcos that we're educating with, but this month is also Gynecological Cancer Awareness Month, and we've kind of been like pushing that in the clinic. Women coming in for their annual physicals. I can't emphasize enough the importance how women have to. I mean, with men too, and when their month comes, we could address that. But this month for women, it's get yourself checked out. Check the irregularities, check the stuff that your body's going through, and we'll go through that as well, just so that we know what are some of the normal and so-called not normal that you should address to avoid.
Okay,
And
you're
down
making
the
me
line.
nervous.
I'm gonna.
No, it's fun stuff. It's fun
Listen,
stuff.
I
You see,
know-
I
I-
do a little dance.
I know.
Yeah.
I know. For this live, I got a question. Where is your clinic? located?
Health Solutions. So Murray's Village Road Gap, across the street. There is a gap to come down the hill where there are green buildings. Silky's Car Garage used to be up at the top of the road. That's now not there.
Yeah,
We're
bush.
just in that gap down the hill. And you'll actually see the Health Solutions sign off the main road.
Oh yeah.
Posters on the green wall.
On the green
so
wall.
we're down that gap.
Yes.
Oh,
all right.
on the wall, with all those.
Yeah.
Right, medical. Yes,
Yeah.
you'll
Yeah.
find us down
Pics
there.
on it. Oh, that's you
Yes,
guys. Those
that's
are you
us.
guys.
That's us.
I always wonder what's down there.
Now you know, see?
Good stuff.
No pun intended. All right, we'll take a quick break and come right back, but we have to get you with these messages before that. The CWSA SWMU announces its annual free